Friends, welcome back to some more peptide talk. First and foremost, this is not medical advice or medical information. It's only for research purposes only. All right, today I would like to talk about the KLOW stack with you guys. I've used it for a period of 2 months. I'd like to talk to you the amazing benefits that it worked for when I was testing it on my rat. With my rat, I had tremendous results, okay? Let's talk about it. First, there's what the KLOW stack is it's 4 different peptides. It would be GHKCU copper, KPV anti-inflammatory, and BPC 157 and TB 500, which are a lot of gut healing, tissue repair, anti-inflammatory, and so forth. Okay, let's talk about it. Now, there's 2 different ways you could acquire it. You could acquire it as a premixed stack in a vial, or you could buy the 4 peptides separately and kind of in a way mix them together yourself. Which is a better route to go and why? Okay, I'll use my rat as an example. My rat preferred to have all 4 items to have them dosed at 1 mg per day. That means 10 syringe units of each per day. Okay, versus if on my rat, if I would have used the premix stack, because that one is mixed with or reconstituted with 2 mLs, which is 2 full syringes of backwater, the recommended dosing for that would have just been 1 mg or 10 syringe units of all combined together. Okay, for just, again, so if you used 10 units or 1 mg per day of all of them already mixed together, you would have only received roughly 2.5 units of each peptide per day. My rat and I felt that wasn't enough. So again, we didn't want to go the route of using the premixed one. We would rather use them separately. By using them separately, it allowed us to structure this in a way where we could do our dosing exactly how we wanted to. We could customize our dose by having the vial separately. So what we did was we kept a spare mixing vial around. With my rat wanted to do 2 mgs of each of the 4 peptides per day, 1 mg of each in the morning, 1 mg of each in the evening. So what we did for my rat was we would get 1 mg of each of those 4 peptides, put them into a mixing vial, which came to a total of 40 syringe units of total in a mixing vial. We'd put that into a syringe and dose it in the morning, and we would do the same at night, okay, and do another 40 syringe units at night. So again, a total of 2 mg of each peptide per day, 1 in the morning, 1 in the evening. That worked best for my rat. Okay, now I'll tell you what it did for my rat, and then what we'll do is we'll talk about the benefits of it and show you the mixing and so forth. Okay, so just so you guys know, I do also have a Discord chat room. In the chat room peptides can be acquired or purchased through my Discord chat room. Prices are very fair and reasonable in there, and we have some very amazing and unique peptides in there. Again, there's peptides in there that might be able to actually regenerate stem cells, and other peptides that might even be able to regenerate cartilage. Okay, that's just a small. We have a ton of other peptides available. We have the KLOW stack in there. We have retatrutide, for example. A 20 mg retatrutide vial is only $80 through there. Again, you can get 20 mg of retatrutide for $80. Okay, so we have some very amazing prices and a lot of very unique peptides in there as well. Not just the basic ones. There's a lot of unique ones available in there. Now, so let's get back to what this did for my rat. So in my Discord chat room is Revive Compounds within Discord. Okay, and I'll post a link to it below this video. Now, what it did for my rat is my rat has had asthma his entire life. And with that good strong dose that he was working with for research purposes, utilizing the KLOW stack or the 4 peptides from within the KLOW, within the first 3 weeks, my rat did get rid of his lifelong asthma. He can breathe freely. All of his asthma is completely gone. The other thing, my rat for the last 7 years has had rheumatoid arthritis, very severe. Tremendous joint pain, and so forth, and tremendous inflammation. Now, these peptides, again, my rat was running a 2 mg dose of all four of the peptides per day, and he was doing it 5 days a week, not 7 days a week. Okay, so he was taking a 2-day break per week, but he was running 5 days a week on that. Now, he was able to get rid of his inflammation. His joints feel tremendously better, and also, like for example, the TB500 and the BPC 157 they might be able to do gut healing, and they might be able to do tissue repair. So with that occurring, he got tremendous gut healing and tissue repair, and that helped his degenerative tissue. That he had a lot of degenerative tissue through his back, shoulders, spine, and that so forth, and his hips. That degenerative tissue healing repair helped him tremendously. He feels a lot better, can move and walk around a lot better with a lot less reduced stiffness. Okay, so for his rheumatoid arthritis, this was a very good route to go. He achieved tremendous results and success for his rheumatoid arthritis. Also, a lot of rats that might have different autoimmune diseases, okay, might have elevated blood pressure as a result. My rat did. So by me giving my rat, or by my rat working with and testing the KLOW stack for a period of 2 months at an elevated higher dose, he was able to reduce and kind of correct and restore his blood pressure and bring it down into range. So it worked out very well for him. Now, let's talk about the mixing aspect of this, which is also called reconstitution, okay? So this is just an AI. AI is a very powerful tool that many of us in this journey utilize to work with to find out how to correctly reconstitute. Again, that's your mixing. That's how much backwater you add, along with the dosing schedule, okay? So now this right here would be more of the recommended instructions per AI if you were working with the premixed KLOW stack vial that already has the 4 peptides in one vial, okay? AI is recommending to put about 2 ml of backwater. 2 ml would be 2 syringes. Now say the vial you got was a 50, that would be 50 copper, 10 kPV, 10 157, and 10 500 mg vial size, okay? Say that's what you had. AI recommends you put 2 ml of, which is 2 syringes of backwater in there, and then you could do, your dosing would be roughly 1 mg total, which is 10 syringe units per day. But again, you now have 4 peptides combined within a 10 units on a syringe. That's almost nothing. That's almost 2.5 units of each peptide once a day. That's very little. That's a very slim dose. Okay? My rat didn't like that. My rat preferred to do 2 mg of each per day. So again, that 1 mg is 10 syringe units. So my rat was dosing 40 syringe units in the morning, another 40 in the evening, 2 mg of each per day. That worked very well for my rat. Again, it cleared and removed his asthma within about 3 weeks by removing the inflammation, because a lot of diseases are inflammation based and so forth, okay? And tremendous results for his rheumatoid arthritis. He doesn't have any more pain. His inflammation's gone. His blood pressure's corrected and restored. Achieved tremendous success and results. Okay. Now let's talk about the peptides that are in there. Let's give a generic overview of what they do. Okay. So again, wound healing, tissue repair, conditions they could might be able to help with skin injuries, burns, surgical wounds, tendon, ligament injuries, and muscle damage, and so forth. Okay. The GHKCU promotes wound healing, stimulating collagen production, and so forth. BPC 157 supports tissue repair. TB500 enhances cell migration and tissue remodeling. And then it says inflammatory conditions, inflammatory bowel disease, IBD, colitis, dermatitis, and other chronic inflammatory disorders. Mechanism, KPV, which is a potent anti-inflammatory peptide. BPC 157 modulates inflammatory cytokines and supports the epithelial barrier. The KLOW is explored by reducing inflammation and supporting tissue integrity. Conditions. This is a gastrointestinal disorders conditions, interstitial cystitis, leaky gut syndrome, mechanism BPC 157, a small pilot study in humans. So here's some of the pilot studies. You'll see that a lot of these they were really tested for like autoimmune diseases, leaky guts, because again, tremendous gut and benefits towards inflammation and gut health, tissue repair, gut healing. At the end of the day, that's really what a lot of these diseases are. Pretty much most and almost all diseases start in your gut. So if you really wanted to, say you wanted to possibly work towards potentially, say you don't want your rat to get cancer in the future, one thing you might consider is giving him something like they claim the BPC 157 might be able to heal your gut. So if you didn't want your rat to get cancer in the future, you could possibly give him the BPC 157 and actually heal your gut. Something to consider, okay? So these have a lot of tremendous benefits to them. But the important part is you have to also pay attention to how it's dosed and how much of these items you're putting into your rat, okay? Again, with my rat, him and I felt that the premixed KLOW stack was too low. Because again, if you're only working with the recommended amount in that, as AI would recommend, just 10 units on that 50, 10, 10, 10 stack, if you operate and dose off of just 10 syringe units, as AI recommends, you're only getting 2.5 units of each per day. That's almost nothing. That's a very minimal amount. And so my rat and I strongly felt so. With my rat utilizing an increased dose, he had tremendous benefits. Again, it completely removed his asthma from his body within the first 3 weeks because he got rid of a lot of his inflammation. He got rid of majority of it within the first 3 weeks, and then from there he was working more, clearing the inflammation out first, and then working more towards the gut tissue or gut healing and tissue repair from the internal damage with the leaky gut and the degenerative tissue damage and so forth, and clearing the pain out and just overall feeling better. So yeah, my rat did very well with the KLOW stack. I just wanted to share that with you guys, that if you're new to this, might be something worth consider while you're doing your research and development. And again, I do have a Discord chat room by the title of Revive Space Compounds, and I'll put a link for the Discord chat room below the video so that you can go in there, and I'm going to start posting. I'll see if I can start putting tremendous information type documents within the Discord chat room so it can be reviewed, studied, and help you guys build your knowledge base on how these products might be able to help you towards your research and development, working with these products and what they could do for your rat kind of thing, okay? But so far, they're very powerful. And then there's even another aspect of, if you have a plus size rat and your rat's obese, there's tremendous weight loss products in there to where you could help your rat have tremendous weight loss success. So just an FYI, with tremendous peptide pricing in there for your own personal research. Friends, thank you for joining. Have a wonderful day and a great weekend. Take care.